We're going to East London, and that is where, of course, the commemoration is taking place, and on this World AIDS Day. Let's take you live there.
In our communities, the issue of poverty, unemployment, it's a serious matter, of which if I'm living with HIV and I have to go now and again to the clinic to collect my medication, then it means I'm taking some time off. Sometimes we are working part-time jobs and it's difficult for us to go and collect treatment, and sometimes you have to choose from taking your treatment and other things. But I know that you are familiar with our Richitsa report, all the challenges that we are raising there, and you see they're based on our community-led monitoring. That is why today we are here calling for 6 months treatment, so that we can reduce the challenges that we have and also be able to have more people on ARVs, and also making sure that abantu bayahlala ku treatment baya adhere. So that is why I see but I'm not going to waste a lot of time. I have my colleague here, Belinda Sichuchelo. She'll be the one who will be reading a memorandum, and then we'll hand it over. Thank you.
Amandla! Amandla! Thank you, comrades, and all protocol observed. I'm here not representing myself, but as a person living with HIV, I've been taking treatment for 16 years. And it's too much for me to go to the clinic every second month and wait the whole day. Hence, I'm here today representing members of the Treatment Action Campaign, representing the key population within TAC, Nikona, representing people living with HIV, Nikona, sex workers, Nikona, Amandla! Thank you, comrades. So the memorandum is from the Treatment Action Campaign, and it's 6-month ARV refill now. And it's written on the 1st of December. As we mark World AIDS Day, today in South Africa, around 2 million people living with HIV are still not on life-saving ARVs. Some people not knowing their HIV status, others knowing their HIV status but not having started treatment. And worryingly, many people having started on treatment and then stopped. Why? Because our HIV response is being undermined by the dysfunctioning in our health system. Our clinics are in crisis. We leave home early hours in the morning only to wait all day not to be seen. Our files take hours to find or go missing completely. For those who are late for their appointments date, when we return to the clinic, we are shouted at and sent to the back of the queue to wait all day as punishment. Often staff are openly hostile to people from the LGBTIQA community, people who use drugs, and sex workers. And if you don't have an ID when you go to collect your treatment, or you don't have a transfer letter when you go to the clinic or to another, or if you are a member of the key population, you might be refused ARVs or sent away. Some people living with HIV continue to suffer these daily indignities. Yet frustration and fear of this unwelcoming environment means people stop going, or are scared to go back to the clinic after they are late for or miss their appointment. Even though often this is for unavoidable reasons, one thing is clear: no one wants to go to the clinic more often than necessary, especially just to pick your medicines. The Treatment Action Campaign is marching today because there is hope. There are simple solutions to improve this situation. One is for people who are collecting ARVs to get a longer supply of medicines. A longer supply of ARVs will mean fewer trips back to the clinic. It will make it easier to stay on treatment by reducing the cost of getting to the clinic and the hours spent waiting there 4 to 6 times every year. Importantly, it will also reduce congestion and overall waiting times for everyone using the clinic and reduce the burden on already overstretched healthcare workers. There is a strong evidence that shows that Supplies, longer supplies will help people to stay on treatment. In the context of South Africa's treatment retention crisis, this is essential. We are marching today because South Africa's national guidelines allow people to get a 6-month supply of ARVs from their clinics. The World Health Organization recommends that preferably people doing well on treatment should be getting a 6-month supply of ARVs. This will mean going to your clinic just twice a year for clinical reviews, rescript, and collecting your next 6-month supply of pills. It is now December 2024. While people are getting a 3-month supply, there is no public implementation plan in place for getting people a 6-month supply. This is an extremely simple intervention with big gains for people living with HIV and the public health system more broadly. More than 6 million people across South Africa are already getting a 6-month supply with good retention and virally suppressed outcome. So why not here in South Africa, where we have the biggest burden of HIV in the world? We are marching today because another simple solution exists to improve retention for people living with HIV to collect our medicines closer to where we live or work. Out of the facility pickup points which already exist in South Africa can make ARV collection easier and quicker, but 18,860 people, which is 38% of those surveyed by Richise over the last year, still wanted to collect their ARVs closer to home. We urgently need many more external pickup points closer to where people live and work, including in rural and peri-urban areas. To make this happen, we need the department to make it simpler and more fairly funded for more community-based organizations to register and run external pickup points. The funding model must be geared towards reimbursing operational costs when community-based organizations are only providing treatment collection services to a small number of people. 10 rand per person is not enough. This will only provide easier access to external pickup points for people who live with HIV, but allow community-based organizations to participate in supporting people to stay on treatment and improve retention in their communities. Early childhood development centers are allocated throughout South Africa's different geographics. They are already registered as service providers. They could provide a possible solution to providing treatment to people closer to their homes and workplaces. We are marching today because not only do we need to make ARVs collection easier, we must immediately stop the ingrained culture of punishing those who are late for appointments. Healthcare workers must recognize that as people living with HIV, we might be late for or miss an appointment and might even miss taking a pill. That is normal. The response to this must be to immediately give people their ARVs when they return to the clinic. To minimize any treatment intervention as much as possible. This ensures that a missed appointment does not become a prolonged treatment interruption, which can increase illnesses, hospitalization, and death, as well as onwards transmission. We often, when we return to the clinic, we are punished. Richise data shows that 2,604 people who had been late for or missed their appointment in the last year said staff shouted at them, which is 12% in total, and 3,353, which is 15% in total, were sent to the back of the queue, being forced to wait the whole day as punishment. Alarmingly, some people even report healthcare denying them ARVs following a late or missed appointment. Yet, national guidelines says that no punitive actions should be taken. These guidelines must be implemented properly. Importantly, national guidelines also state very clearly that until 28 days has passed, you have not missed an appointment. The guideline clearly states you should be able to collect your pre-packed ARVs at your pickup points with no change to your service delivery. We fought hard for these flexibilities. These flexibilities is not being implemented, and pre-packed ARVs continue being returned from pickup points to clinics or CCMDD in 7 days. We are marching today because changing between clinics can also turn into a nightmare. Over the last year, 1,343 people told Richita that they or someone they know had been denied services without a transfer letter, something that is not required by ART guidelines to start or restart your ARVs. The reality is that people often relocate temporarily or permanently, and people do not have the money or time to go back to their original clinic to get a transfer letter, often hundreds of kilometers away. At times, clinics actively withhold them. While transfer letters are important, they must not be used as a barrier to helping people collect their ARVs. We continue to be alarmed that in today's world, healthcare workers are still having to rely on a physical transfer document to know that a person is taking ARVs in the public healthcare system. In addition, migrants and those without ID and people who use drugs, sex workers, and the LGBTQIA plus community members also reported to Richita that they had been denied services in large numbers. This is humiliating, painful, and unjust experience to go through, a violation of constitutional right to health, equality, and human dignity. While some people may suffer the dignity of trying to get services, another time, others can be pushed away from care altogether. We are marching today because we simply cannot get everyone on HIV treatment when intolerable condition remains at our clinic, when guidelines are not implemented, or by denying people health services. We are marching today because the department says it wants more than 1 million people to start or get back onto treatment by the end of 2025. But the truth is, treatment for all and reaching the UNAIDS 95 targets is impossible without making it easier for people who collect HIV treatment. This must include decongesting clinics by providing 6 months supply to people doing well on treatment and 3 months supply for everyone else who is not sick. We are marching today because we have been calling for 6 months supply for many years, yet the department keeps asking us if people live with HIV really want this. As people living with HIV, we can tell you we really want it, and hear us today. We ask that you carefully hear and take to heart the demand as are given to you today. These are too nice to have. These are not too nice to have. They are life-saving. The demands are as follows. Number 1, the National Department of Health must urgently finalize the planning and forecasting process to ensure that all eligible people get a 6-month supply of ARVs if they want it. An implementation plan with timelines must be made publicly available by 15 December 2024. Rollout must start before the end of 2024. At least 30% of people live with HIV must be receiving a 6-month supply by the end of June 2025. Okay, number 2, the National Department of Health must hold provincial and district health department accountable to ensure that everyone else who does not want a 6-month supply and who is not sick gets a 3-month supply. This includes ensuring that all facilities, clinicians know the guidelines related to 3-month supply, which is 3 mmD, actively encouraging and supporting acceleration implementation at all facilities, sub-district, districts and provinces, HIV program meetings, and monitoring 3 mmD coverage as to how many people collected HIV treatment and the percentage who got 3MD and hold facilities that are underperforming accountable. Number 3, the National Department of Health and Treasury must ensure that an additional 100 small community-based organizations, including those in rural and peri-urban areas, are registered, viably funded, and are running external pickup points by end of June 2025. 4, the National Department of Health must implement the guidelines that support 28-day flexibility for the collection of ARVs refill. This means until 28 days have passed, you have not missed an appointment. Your prepaid ARVs should remain for collection at the same pickup points and will not be returned to the clinic or to the CCMDD. 5, the National Department of Health must hold provincial district health departments accountable to fix the other challenges in our clinics that make people stop taking ARVs. Clinic must be held accountable to immediately stop taking any punitive actions if people are late or miss their appointment, including shouting at people, sending people to the back of the queue, or withholding ARVs. Clinics must also be held accountable to immediately stop denying people services and ARVs without a transfer letter, ID document, or because they are a member of the LGBTIQ community, sex worker, or use drugs. We demand a written response by the 1st of January 2025 and a meeting to respond to our memorandum on or before the 31 of January 2025. Thank you. Amandla!
Viva Belinda, viva! Amandla! Amandla! Now the DP. Okay. So now UDP and Minister with the Premier, they will sign our memorandum and then give us just a few words of response. Oh. Why sign now? 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 But o premier why sign now? GSCY signer, GSCY signer. This is yours, okay? This is DP. This is Sign le ka premier ke be se let's. Yeah, we have one. That's an envelope. Oh. So the one that you are remaining with, we ask you to sign it. I think from Pila Singa na mind the papra. Proud envelopes. No, it's Bazola. Amanda! 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 Amanda!
All right, so we come out of where the Deputy President Paul Mashatile is, and of course on this commemoration of World AIDS Day, signing some of the demands that, of course, the group that has gathered there have. Some concerns, of course, in the majority. What we're hearing this year is that the time frame to access antiretrovirals remains a challenge, and there are calls for 6-month supply of antiretrovirals, some of those indicating that that will be much better for them in terms of sustainability and how they take those ARVs themselves.